President Biden delivered a speech today on health care, Medicare, Social Security. He used the opportunity to praise his misnamed Inflation Reduction Act and criticize the Republicans' commitment to America, their agenda.
I wish I could say the Republicans supported this progress in reducing health care costs and strengthening Medicare. That would be good for all of America. But they have a very different idea. Every single Republican voted against the Inflation Reduction Act. And when it actually came time to do something about inflation around the kitchen table, every one of them said no, House and the Senate.
The president today saying the Inflation Reduction Act was probably the best piece of legislation ever to be passed. I mean, it is, according to him, the cure-all for everything. Joining me now to discuss this is Congressman and Dr. Greg Murphy. He serves on the House Ways and Means Committee. Prior to his time in Congress, Dr. Murphy had a long career in medicine, including 3 years as chief of staff at a medical center in a 1,000-bed trauma center in North Carolina. He represents North Carolina's 3rd Congressional District. Congressman Murphy, welcome back to Washington Watch.
Good afternoon, Tony. I hope you guys are doing well.
Doing well. Greg, let me first just get your reaction to the president's speech today.
Tony, I don't know where the disconnect is between President Biden and reality. I think he's really started to believe his own fabrications. That was the most misappropriately named bill I've ever heard or law that I've ever heard. It's going to absolutely do nothing for inflation other than cause it to be worse because of out of control spending. You know, I think it's very easy to see that the Democratic majority now loves to play upon people's fears and upon people's emotions, while at the same time ruining the future history of this country. And so for him to go off on Republicans, we're the adults in the room. We're the people who actually care about where the money comes from, how we spend it, such to ensure a future for our country. And it's reckless at best, honestly, his words. And sadly enough, it's destroying our country. The good thing is the American people see it because they see inflation that has literally gone out of control, the highest rates we've had in 40 years. The same thing with crime, the same thing with what's going on at our southern border. So the Democrats love to say, believe what I say, not what you see. And so fortunately, most Americans believe what they see, and they see this party and this president destroying the country.
So, Dr. Murphy, I'm going to get you to address the specifics of what the Republicans are proposing, because health care is generally one of the top-rated issues that people care about when it comes to policies and elections. And now, of course, this time it's being eclipsed by crime, inflation, but health care remains a top priority. We've got so much stuff going on. But among the number of issues that the Republicans are focused on in their commitment to America, speak as a doctor to what is being proposed by Republicans and how that contrasts with what the president and his administration is pushing.
Well, we're talking about personal freedom. We're talking about the ability for individuals to choose their health care, not come down as government-run health care. Tony, I've been in medicine for over 30 years. I've run practices with my surgical practice. I actually still take care of patients. I operated yesterday and took care of some patients this morning. I have seen the meteoric rise in health in government intervention in healthcare, which is destroying it. This is the reason it costs so much today, is because of so much government intervention. And the true fallacy that people have who claim about, quote, Medicare for all, truly don't understand what that means. Medicare itself is driving doctors out of business. And there's a very good statistic, especially after COVID and after the pandemic, which honestly, the public health emergency should have ended 10 months ago. We have 1 in 5 doctors that is planning to retire in the next 2 years. 1 in 5. And if you look at surgeons, of which I'm one, it's even worse. And so for them to talk about how they're going to bring health care for all, they have simply, honestly, Tony, no comprehension of what that means. And so actually trying to help our individuals in the business of medicine and also provide care to patients, not worrying about bureaucrats, is really where the Republicans are trying to make a true integral effort. We get knocked a lot of times by the Democrats who play upon emotion rather than reality, that we don't care. It is literally just the opposite. We care not only about the present, but we care about the future. It is simply a Democratic ploy that wants to play upon patients' emotions, that we want to take away Medicare and do all those other things. Absolutely absurd. Medicare is a non-solvent entity as we move towards the future. We want to assure that it's going to be there for all Americans for all as long as we can make it very, very possible for them.
Dr. Murphy, I want to speak about that future for a moment because you talked about 1 out of 5 doctors preparing to retire. Worse for surgeons. My daughter is in the medical field. One of the other issues that you're addressing, the Republicans' commitment to America is addressing, is the conscience protections of those in the medical field, which has been trampled upon by this administration. So you have this gap that is beginning to be created with people leaving the field, but when you don't respect the convictions and beliefs of those that want to pursue health care, I mean, we're going to have a huge void.
Well, right now in medicine, sadly enough, Tony, what we're seeing is what we've seen in colleges and universities for many, many years. I was on the board of trustees of my alma mater at Davidson College, and I saw under the last president the college turn from a very reasonable, balanced institution to one that was so far left it was not not recognizable anymore. You didn't have balance anymore. It was only teaching one view. And sadly, now that has gotten permeated into medicine, where you're having in the state of California, politicians tell doctors how to practice medicine. And this is where it is. We're now in medical institutions now. It's getting further woke, as it were, that you have to talk about genders and all these other nonsense things rather than worrying about a patient's cancer or worrying about their kidney stone and some of the other things. It's an absolute eye off the ball of what's happening because I love to use this analogy. It's the emperor's new clothes. Everybody has to do it because of, honestly, of peer pressure.
Right.
It's poor for the system, and it's going to damage our country.
Well, again, another clear contrast being provided to the American people between the two governing policies of the two major parties. Congressman Murphy, always great to see you. Thanks so much for joining us today.
Thank you so much, Tony. God bless. Have a good day.